Many children and adults in our area have health problems caused by trauma and toxic stress. We all can help in the effort to empower survivors so they can thrive.
We are the Tristate Trauma Network. We support agencies and professionals doing the work around trauma survivors, trauma healing, and combating toxic stress in Southwest Ohio, Northern Kentucky, and Southeast Indiana. We want to share here to raise awareness and understanding with the public. We want to show why it's important and that the time is now for more collaborative action. So my mission now is, helping people understand, but also supporting people doing this real hard work of helping trauma survivors heal and get to a point, hopefully one day, of thriving. First of all, I want to say that trauma knows no age, socioeconomic, gender, race boundaries. It's happening to all of us. 70% of the population has experienced at least one traumatic event in their life. So it's not those people, it's us.
Trauma comes in many forms and from many causes. Common causes are physical abuse, sexual abuse, or emotional abuse. Certainly, post-traumatic stress disorder, PTSD, can happen from military or war experiences, exposure to terrorism, or with first responders like firefighters, police, or healthcare workers from emergencies or mass shootings. The coronavirus pandemic and crisis across the globe and here at home can cause children and families, especially those families closely impacted, to experience trauma. Medical trauma can result from severe illness, injury, surgery, or invasive treatment. Trauma and toxic stress can be caused by neglect, separation from loved ones, divorce, substance abuse in the home, extreme poverty, human trafficking, jail time of a parent, bullying, household mental illness, or other family dysfunctions. Less commonly known is that witnessing of violence or abuse can cause trauma. These are some of the faces that need our help and our healing. Importantly, the lasting impact and lifelong consequences of trauma and toxic stress is significant, if not healed and resolved. In fact, people who experience trauma are 3 times more likely to have anxiety disorders, 2 times more likely to develop depression. Serious learning challenges and behavior problems can result if not treated. Trauma and toxic stress are connected with addictions, like opioid addiction and other drug abuse. Patients can live in a state of constant fear and helplessness.
People who've experienced trauma are more likely to have heart disease, they're more likely to have lung disease, they're more likely to have cancer. People aren't getting the treatment they need. Access to treatment is difficult. We want people to feel like they're functioning at the highest level possible, despite what's happened and what they've had to go through. So we do that through providing lots of high quality training and consultation services. At this point in time, I'm happy to say that we have 220 professionals in the tri-state area working in different types of roles who are trauma responsive care certified. And they didn't get that easily. So empowerment is very important as a trauma-informed care principle. And we need to empower trauma survivors to be partners in their healing process. And I think anybody involved in our network wants this for our people. We want this for our fellow human beings. We want this for our brothers and sisters and parents and coworkers. And we want everybody to know that there's hope, that there's healing, and that there's thriving that can happen.